Hey guys, welcome to another topic of discussion today. Today we are going to discuss the recall session of Anaesthesia Osce July 23. So today most of the questions are image based questions, and today we are going to discuss the first 5 questions of this session. So first question is image based question which showing the 3 layers of the muscle with transverse process in this. Okay, so this is nothing but your trapezius major, then middle one is rhomboides major, third is erecta spinae, and the plane between erecta spinae and transverse process where the block has been given, and this identify the block is known as erecta spinae plane block. So next question is nothing but they are asking to expand this TM, RM, ES and TP. So TM is nothing but your trapezius major, RM is nothing but your rhomboideus major, and ES is nothing but erecta spinae muscle, and TP belongs to transverse process. So next they have asked about mention any 4 surgeries where it can be used. So 4 major surgeries where it can be used includes number 1 is your MRM, modified radical mastectomy, and the next we are going to involve it is used in the patient with a rib fracture condition as a part of an analgesia, and it's also involved in the procedures involving posterolateral or anterolateral thoracotomy, like for example like lobectomy, like the procedures where we can use, or else we can use in the procedure with minimal invasive surgeries like VATS, nothing but video assisted thoracoscopic surgeries. These are some of the surgeries where you can use the erecta spinae pain block. Okay, coming to the next image based question, which is nothing but your vaporizer. Here on vaporizer has been shown in the image and asked about identify the type of the vaporizer, which is nothing but an Aladdin cassette type of vaporizer. Color coding is blue is given, so which is belongs to the desflurane vaporizer. Actually, Aladdin cassette vaporizer of desflurane is asked, and they are asking about next question is a boiling point and a MAC value of that vaporizer. So boiling point of desflurane belongs to 22.8, and MAC value of this desflurane agent belongs to 666. So this is the MAC value of a desflurane. Coming to the third question is mention any 2 specific feature of this vaporizers. So this Aladdin cassette vaporizer is actually more magnetically coded, color coded, so that one vaporizer can be attached to the part of the machine at one time, and it is easy to you can't fix the other vaporizer in that, and it is also color coded specifically. Next, coming to the next vaporizer is nothing but your next salient feature is electrically heated and electronically controlled flow over type of an vaporizer and temperature compensated. So and also it having a most important feature of this is having a central processing unit, and where it is electrically heated, which the desflurane sump is there, it will be electrically heated and then the vapors are produced. Okay, so you can mention any of this 2 features of the vaporizer, so that you will be getting full marks. Coming to the next question, your answer should be crisp, that is needed. Coming to the third question is here we are seeing some Mapleson circuit. You know that is the distal part is considered to be your patient end, and then close to the patient is the fresh gas flow, and then there is a reservoir bag in the other end, and APL valve is there close to the reservoir bag. Okay, so identify the type of the vaporizer, which is nothing but your Mapleson type D type of vaporizer actually. So modification of the Mapleson D type of vaporizer is known as Bain circuit. If we have inner and outer tube is there both, then we call it this as a Bain circuit. This is the other thing. Then next question is asked, what happened if the length of the tube is increased? So if the length of the tube is increased, what happened is nothing but the resistance which is inside the tube will started to increase more. when the resistance inside the tube is increases, and also because the volume of the circuit is getting increased, so that it needs more fresh gas flow to wash out the dead space gases. So these two things will happen if the length of the tube is doubled. Coming to the next question is nothing but the ask is to test of integrity of this Mapleson D circuit. Most commonly used test is Pethick's test, which is the integrity of the inner tube we can check. And next most common things is nothing but Fox-Crompton-Smith test, which is most commonly used to evaluate the integrity of an outer tube, which is also thumb occlusion test they will tell. I think these two tests I explained in detail in my another videos. Just take a look on the Mapleson circuit videos to know the full details of this test. So next question is why it is good for control ventilation. For control ventilation, to prevent rebreathing, we need just minimal volume, that is 1.5 to 2 times the minute ventilation we will require fresh gas flow. Minute ventilation of this required to prevent rebreathing in the circuit, which is approximately equivalent to 70 to 100 ml per kg per minute. When you are telling in per kg body weight, then 70 to 100 ml per kg per minute is required. Whereas it is not good for spontaneous ventilation, where it requires more fresh gas flow, which is about 200 to 300 ml per kg per minute. So to prevent rebreathing, we require low minute ventilation of 1.5 to 2 to acquire a good controlled ventilation. So that's why we are using less fresh gas flow. So we are using it better for controlled ventilation. Coming to the next is, you have image-based question again. Regarding biomedical waste management, they have shown the symbol and asked about what the symbol denotes. The symbol, what it denotes is nothing but it's a biohazard. It's a biohazard medical waste. So that is a symbol, a biotoxic medical hazard or something. Biohazard is the most commonly termed. Coming to the next is the principles of biomedical waste management. Three main principles is nothing but, first, whenever you have a medical waste, we have to segregate the waste, whether it is a solid waste or liquid waste, what is cytotoxic waste, or first we have to segregate the waste of this. Next, after segregation, we have to treat the waste. Treatment of the waste is next. How will you treat it? Either by autoclaving or by incineration, or whichever procedures we need, we have to treat that waste. Next, followed by which you have to disposal the waste. Either they may be disposed in a secure landfill or deep burial, whichever procedure can be followed. So these are the main things. First, segregate the waste, then treat the waste, and then dispose the waste appropriately. These are the main principles of the biomedical waste management. And next question asked is, mention the things disposed in blue, yellow and red bins. So coming to the first, yellow bins, that is mostly your soiled things, that is infected anatomical waste, anything actually. It's mostly soil things like placenta, anatomical waste like placentas, or the having some laboratory wastes like cotton soaked with blood or something. Next, we have cytotoxic drugs. These are the main things, that is mostly soiled items and infected things are to be disposed in the yellow bin. Coming to the next bin is nothing but the red bin. Red bin is nothing but your infected plastics are most commonly removed here. That is your catheters, IV fluid bottles or IV lines, that is IV lines, extension of the IV lines, and other infected things like rubber catheters or something, that all have to be disposed in the ever red bins. Okay, next most common is actually your blue bins. In blue bins, that is vials, ampules, drugs like antibiotic vials, ampules, or other like mannitol, glass bottles or something. All things have to be disposed in the blue bins. These are the some of the things. These are three questions asked regarding the biomedical waste management in this question. Coming to the next fifth question, it's a history based question. Actually, they have given history and chest x-ray and asked regarding, which is nothing but 28-year-old male patient following a road traffic accident. He has complaints of pain over the right side chest wall associated with breathlessness, tachycardia and hypotension. and they given the X-ray image where it is actually they're having a right-sided pneumothorax with mediastinal shift. So right-side mediastinal shift is there, and the patient is having tachycardia and hypotension. So together it constitutes the rib fracture causing pneumothorax, that is tension pneumothorax the patient is having. Okay, so tension pneumothorax of right side, right hemithorax actually, right side actually. What is the immediate management and what is the final management? They have asked two questions in it. Immediate management, what we will do? We will use a needle thoracotomy. So needle thoracotomy, where we will do needle thoracotomy? Needle thoracotomy in the triangle of safety. That is triangle of safety is the most boundaries of triangle of safety. You have to look into it. What are this latissimus dorsi, pectoralis major, all things will be doing, and base of that horizontal line connecting the nipple. And next is the final management. Final management is by ICD placement in the fifth intercostal space, that is in the anterior axillary line. That is the ideal site where you will place an ICD. Okay, these are the two questions they have asked. And third question is, why hypotension occurs in this condition in the patient with pneumothorax? Why hypotension occurs? You know, in pneumothorax what happens? The intrathoracic pressure will increase. So whenever the intrathoracic pressure will started to rise, what happens is the venous return to the heart decreases. In the IVC, the venous return to the heart will started to decrease. So blood flow to the right atrium, right ventricle decreases. So and left ventricular output decreases. So cardiac output will decrease. And also due to the tension pneumothorax, due to the mediastinal, there may be aortic compression also will be there, which also resulting in further fall in BP. So these are the two things can cause hypertension in the tension pneumothorax patients. Okay. Next, I think today we have discussed the first 5 part of the questions, and another 5 point of the question is bending. Another 15 questions are bending, so I'll be covering it in one by one part actually eventually. So if you like my videos, just put a thumbs up button, and please, if you don't subscribe my channel till now, please subscribe my channel so that it will motivate me to do more videos for you guys. So, and if you have any doubts, just leave it in the comment box.